All right, hey, welcome to Facebook Live. We're going to try to do this quick. 15 minutes. It's very, very powerful, life-changing information if you utilize it. They say how education is powerful, and it's only powerful if you use it. Same with, supplements or weights in your basement. The weights aren't powerful. It's if you use it correctly. So the tools I'm going to give you today can radically transform your life. I promise you. I've done it over and over and over again. And I'll share a couple of my stories, how I healed through a process 10 times faster than normal. They didn't give me much hope. And one time it was just incredibly fast. So I'm going to share a couple of those stories as I go along. But let's just dive right into this. Pain, acute pain, chronic pain, is it good? You're saying, no, it's not good, Dr. Tressler, it's horrible. It is good because it gives you a warning sign, like the warning sign on your car. Ding, 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 the red light comes on. It gives you a warning that something's going wrong. So you got to investigate it. So it is good. Chronic pain can ruin your life, though, if you don't discover how to correct it. Not how to manage it. This isn't, pain management. This isn't cover up your symptoms with drugs and get by. This is heal. So let me share something with you. Last fall, Pittsburgh, and this came out of Pittsburgh, National Institute of Health, helping to end addiction long-term research in UPMC and the University of Pittsburgh. They have been awarded 9 grants. Listen to this. 9 grants totaling more than $32 million. Get me a piece of that pie. I can help you. $32 million to improve prevention and treatment strategies for opioid misuse. $32 million? Come on. And addiction to enhance pain management. So where is the money? It's not in correcting, it's prevention and treatment strategies. What about, let's eliminate the crap. Let's figure out how to fix it naturally. That's chiropractic and natural health care. I'll show you some studies, because I teach this to our state. I teach for the state board, and I teach research. And I have data that goes a mile deep on research of chiropractic care and natural health, healing way better than drugs. So listen to this, 20 to 30% of the 50 million adults with chronic low back pain in this country also have a coexisting mood disorder. They probably did a $1 million grant research on this. Have a coexisting mood disorder and are prescribed opioids more frequently and misuse opioids at a greater rate than the general population. When you have chronic pain, you're miserable. You're not happy. If your wife is on the couch with a pounding migraine and you say, sweetie, let's go to the movies and have dinner, she's going to say, no. I'll be very polite. My tongue wants to slip when I talk. I get emotional and get excited and curse words come out. I won't do that. So here's one site of what they're trying to do. So this is what they say can help you. They get these grants, and they haven't come out, because this just came out last fall, what the strategies are yet from UPMC and the University of Pittsburgh, but I can pretty much guarantee it's not going to be Dr. Tressler's chiropractic program, Dr. Tressler's health program that can transform your life in a very short period of time, and very little cost compared to what they do. It won't be that. So one is trigger point injections. So they get, I have this from my lamb. So my sheep had birth. See, I'm a part-time farmer too. I have 50 sheep, 14 cows, chickens, ducks now, a goat. And one of the lambs had a problem. So the vet gave us this and said, here, give her a shot 3 days. So we can do this right into the trigger point. So that's those trigger points. Man, that looks scary. Those trigger points, you're like, oh, right there. Well, let's just inject the sucker with some anesthetic, numb it up, saline, the healthiest thing, and some corticosteroids and see if that works. Right into the doggone muscle, the tender spot. Think of this. That's not where the problem is. It's existing somewhere else. It's setting that up. Remember this analogy. If I had a dog here and I stepped on its tail, where would the noise come out? Not the tail, the mouth. So what does medicine do? They say, look at the mouth. Look how bad the noise coming out. So they get the drug, or they tape it. There, we fixed the problem. You didn't fix the problem. I'm stepping on the tail. The mouth is the noise, the symptom. Where the symptom is hardly ever the problem, the site of the problem. So, thanks for everyone for watching. I get excited, can't even read this stuff. Let's put my glasses on. Counseling, listen to this crap. Counseling and educating regarding pain management and pain-related issues, because they can lead to emotional distress. Well, Mary, we're gonna talk about your pain. We're gonna discuss it. And we're gonna try to deal with it appropriately. I would say, screw you. Get rid of my pain. I'm not gonna talk to you about this. Isn't counseling about my pain. This is, I want it eliminated. Good God, this is crazy. And this is where, and I don't know what these grants are for, so I'm not saying that that's what they're for, but $32 million going to University of Pittsburgh and UPMC to manage strategies. The third is physical therapy. That's the best. No chiropractic. No chiropractic. Listen to this, and we're going to get to some answers in a second. In the Pittsburgh designated market area, here we are in Pittsburgh. What's it like in Pittsburgh? Nearly 3 out of every 4 people, 3 out of 75%, said that there is a problem with opioid overuse in their community. 8 out of 10 believe that the healthcare industry should more closely monitor opioid prescriptions. About 1 in 3 indicate that they have a friend, a family member, a close acquaintance who suffered from opioid addiction. This was the leading cause of death in America under the age of 50 or 52 a few years ago. The leading cause of death. Among those who had someone close to them suffer, about 3 out of 4, 75%, said that they did not know about the person's opioid use before the person developed an addiction. Crazy. So, several years ago, I'm riding my bike because I thought that would be easier on my body, less pounding, than running and sprints and heavy weightlifting. It's for my rugby season, to go out and pound myself against other grown men with no equipment but a mouthpiece. So I thought, I'll ride a bike. Well, coming down a hill about 30, 35 miles an hour, my front tire came completely off. Quick release, just somehow released quickly. It went off, and I went straight down on the side of my head. Thank God I had a helmet, or I wouldn't be here. Thank God it turned my face. And I hit my shoulder. So I fractured my scapula, my shoulder blade. And the fracture, that's that big wing, that big triangle bone. The fracture was like that. It was about that long, about, I don't know, 1/4 inch wide, and broke. It wasn't just a crack, it split open. Well, the surgeon said to me, look, this isn't good. You won't need surgery, and I already knew I didn't need surgery, but it's going to be a long road. So I looked up the prognosis, how my outcome would be, and it looked very dim. One person said they did a similar injury and it took them about a year to do a push-up, one push-up. Well, before leaving the hospital, the doctor, she came over, and I was a patient. I wasn't Dr. Trusser. I didn't tell him I was a doctor. And they were probably wondering how I knew so much science and neurology and health, because I knew my stuff. The nurses knew. And the doctor came over and she looked me in the eye and she said, you're going to have to take Percocets, an opioid, 2 to 3 times a day, 1 to 2 pills each for 6 to 8 weeks. I said, are you kidding me? I said, I will not take that. I said, let me tell you something. And then the doctor was going to come out of me, and the rugby guy was going to come out of me, because she could have made me addicted to opioids, which is the same chemical makeup as heroin, Why do you think you run out of opioids, they won't give them to you anymore? Because they wanted to give me huge bottles of this stuff. I mean, you're talking 100 pills, 300 pills, and several, I could refill it. You're kidding me. And they say addiction only takes a few pills up to maybe a week, and you're completely physically, chemically addicted. So I'd have been a wasteoid. So I said, are you kidding me? Well, my wife jumped in front. She said, doctor, because she knew what was going to happen. She said, what else? I mean, is there any other choice? You could take some ibuprofen, try that. She just walked away. She was pissed. Like, you're pissed at me for questioning you? Get off your little high horse. So I went home. I didn't take one opioid. Praise God. I had to take ibuprofen. And I would take it once or twice a day. I took about 600 milligrams, sometimes less. The pain, and I understand your pain. I was in a sling, I was in my office, and I'm going to share with what I did and what some of the things I did that you can heal. I would be in my office, and this pain would it felt like hot, like oil coming down through my body, and I would feel this pain start to rise up in me, and I'm like, oh God. And I'd say, I'll be right back. I would walk out. I have a back porch. I would sit on my back porch and just bawl my eyes out and just cry and I would take my ibuprofen because I knew it was coming. I'm like, oh God, here it comes. Here it comes. I would take my ibuprofen and then sneak out, and it would take about 10 minutes before I was physiologically changed from bawling my eyes out, I guess. And I'd come back in. They're like, you okay? I'm like, I'm fine. Round 2. And I did this for 6 weeks, but then the pain was gone. Let me share something with you. In December 2016, chiropractic and manual therapies, these are studies. These are science-based studies. Spinal manipulative therapy, that they studied this on pain threshold. Each participant had an adjustment to their low back. And research found that after engaging in one session, listen to this, one session of a chiropractic adjustment, subjects reported increases in pressure pain threshold. Where doctors are now being thrown in jail, and they're being reprimanded, they're being under control because this is a big issue. 240 patients had chronic back, hip, and knee arthritis pain. If you have that, if you're out there going, that's me, every day the weather changes. My knees, my joints, my hips. 6 months, 9 months, and a year. The study found there was no difference in pain-related function between the two groups. Wow. Between opioids and just regular pain medicine. That's what I did. The study found after 12 months, the non-opioid patients, those who took just probably an ibuprofen or Tylenol or something, had less pain than those who got the opioids. The opioid group had significantly more medication-related symptoms over 12 months than the non-opioid group. There it is. I mean, how many studies do you need? And how many grants do you need? Another study, research found that 20% of patients with musculoskeletal pain, joint pain, muscle pain, shoulder pain, hip pain, back pain, are prescribed narcotic pain medications for their symptoms. Study found that 36% of the people who overdosed from opioids had their first opioid prescription. A third of all these people overdose for low back pain. Low back pain. Chiropractic does very well with low back pain. Physical therapy, yoga, stretching. For God's sake, ice, something. Why don't they recommend all these things, not just one, all these things as a treatment, than to prescribe an opioid that ruins your life? Another study, patients who use a chiropractic manipulative therapy and adjustment during their chronic low back episodes had lower overall costs of care, shorter episodes, and lower cost per episode per day than patients in other treatment groups. So it's quicker and it's less expensive. Another study. Those with proper chiropractic treatment develop chronic low back pain. Listen, 60% less frequent when they had chiropractic care compared to all the other groups. Chiropractic care works. Why? Because the nerves submit the pain, and we realign the spine to take pressure off the nerve, to allow the muscle. I'm going to share with you a couple other things, very powerful. A few more minutes here. If you have that muscle pain in your shoulder or your low back or your glute muscle, your bum or your leg, it may be coming from your back, and your back needs realigned to take the pressure off the nerve so it travels. The nerves in the neck come out of the neck. They travel like a wire down into your hand. If I pinch the wire in the neck, the whole arm can go numb. If I pinch the wire here in my elbow, it's just my hand goes numb. So if it were just pinched here, an adjustment will not help. Won't do anything for it. Therapy on the elbow will. But if it's pinched here and you're having elbow pain and hand pain, working on the elbow and hand does nothing for it. It's like working on the dog's mouth. You have to get the pressure off the nerve. You have to get pressure off the dog's tail for it to stop barking. So, supplements. I took, as soon as I had my accident, I took immediate supplements. I ate well, I drank lots of water, and I continued chiropractic care and treatment and rehab on my neck as much as I could, all for those weeks and months. In 2.5 months, I ran, after breaking my scapula, in 2.5 months, I ran a 5K race under 21 minutes. It was right around 21 minutes. So if you run, you'll know that's scooting with a broken arm, with a broken scapula. In 5.5 months, I bench pressed 225 pounds, which I did years prior, so I was back at it. 8 months, I had my first rugby game. The other thing, too, is I physically did physical activity, exercise, every day. Painful? Yes. I would endure the pain then, so I didn't have the pain to have the pain now. I have total function. I don't have chronic pain. I don't flare up when the weather changes or even when I still play rugby. It's fine. So you have to get it moving. And this is what's interesting. In the spine, nerves come out of each side of the neck. So these two nerves in the neck, they come out and they go, one goes down the left arm, the other side goes down the right arm. Well, I couldn't use my right arm, so I would physically do weights with my left arm. I did whatever I could. I did rows, I did chest, I did shoulders, I did biceps and I did everything I could with this arm. When you do that, research shows that there's stimulation, maybe up to 30% of energy output traveling out of the other side of the nerve because it's connected. Well, that means I'm getting 30% healing energy by doing this. Don't say, oh, my arm hurts, my leg hurts. I have to wait until I heal. You'll heal with scar tissue and have permanent damage. You got to heal now. You got to work it now. So there's supplements you can take. And one, we just got this in. It's on sale this week. This week, you got to act on it. You'll save $8. Or if you buy several bottles, you could save $16, $24, $32. Platinum turmeric. What this has in it is very powerful. I'll tell you what it doesn't have in it. It doesn't have this crap. Look at this. Bags of this stuff. People are giving this stuff for pain. This stuff, and if they say, well, there's no side effects. Well, they're morons. There's side effects to everything. Horrible side effects. Supplements and nutrition won't have side effects unless you use them horribly wrong. Take the whole bottle, you may have diarrhea. So, it has turmeric in it. What's that good for? It's anti-inflammatory. It has boswellia in it. What's that? Anti-inflammatory. Glucosamine sulfate. This reduces arthritis, osteoarthritis, joint arthritis, bone arthritis, related pain, stiffness, and swelling in the joint. It also improves function with knee and hip osteoarthritis. It actually repairs the joint capsule, the tissue, to some degree. Isn't that cool? So it stops it from aging. It has chondroitin. You probably have heard glucosamine chondroitin. They used to sell that together. And then people come in and they say, I'm on turmeric. I'm on boswellia. We sell those individually. And I said, you've got to have a product that can have more in it. Chondroitin eases arthritic pain, reduces stiffness, and protects the joint from further damage. So the glucosamine and chondroitin, they help repair the joint. They help repair the joint. I was so excited to get this for me because I can't find all. I'll take individual things, and it adds up. I mean, you'll talk, $80, $100, $120 a month by taking it every individual. This is $28 a month. It's on sale for 20 bucks. And, buy 2 or 3. Take it for a few months and see if it makes a difference. I can tell you, our products, they're better than the Walmart in the cheap brand. It also has MSM, and you've seen this. Relieves joint pain, reduces inflammation, and boosts immunity. It also has BioPerine. What this is, it's a black pepper, but it's a patented black pepper extract that enhances absorption by the nutrients by at least 30%. So they add it, and you'll see this. They'll say, like the turmeric boswellia, it works best with black pepper extract. So what do? Put black pepper and suck it, eat it? No, it's in here. And then there's a few other ingredients, but those are the main ones. And there's also other benefits. Besides joint muscle repair and joint pain, anti-inflammatory, it also has helps, listen to this, brain function, lowers risk of heart disease, prevents cancer, protects and repairs the gut lining, treats IBS, irritable bowel syndrome, leaky gut syndrome, speeds up healing from infections, and prevents autoimmune diseases. Who needs this? Everyone. So I was so excited to get it in. I'm like, first bottle came in, I'm in. I'm like, I'll take this for the rest of my life until they come out with something better. So if you have any joint pain, muscle pain, past injuries, chronic pain, you got to take this stuff. So there was a couple times I was walking. This is just absolutely crazy how fast the body can heal. My sheep had twins. It was bitter cold, so I had to bring her into the barn and I had to catch the twins. So I caught the twins, put them in, and I had to bring the mom. Well, she's 150 pounds, 140 pounds, and she's not moving very fast because she just had twins. Imagine that, moms. So I pick her up, and there was an ice patch. I have a tendency, my family will laugh, I have a tendency to hurry. I want to get things done. So instead of walking into the house, putting on my ice shoes, I have running shoes that have little knobs on them so I can run in the ice. Nothing will stop me. Instead of taking an extra 3 minutes putting those on, I'll just carry it. So I'm carrying across the ice. I slip, and my instinct is to protect her. So I lift her to the side, and I land on my side, and I hear 3 ribs right here just go, boom. It felt like a shotgun hit me. I knew I fractured them. I didn't let go of her. I got back up, put her in the barn, walked into the house, and I said to my wife, get me an ice pack. I just broke my ribs. Oh my gosh. And this is, I think, the 3rd time I did it. So I knew there's not much you can do. I said, give me an ice pack. She says, what are you going to do? I said, I have to heal. I have a rugby game in 2 weeks. I played that rugby game 2 weeks later. Because I did stuff like this. I didn't have this product, but I did products like this. I took a bunch of things where this, you can get it all in one. This week only, 20 bucks. If you're interested, if you're not coming in, just message us and we'll make sure we hold it for you. If you're watching this, that's the benefit. This week only, because we have 3 more products coming out this month. We just ordered new products, but this is a powerful one. That's as much as a pizza for a month, and you could get your joints feeling better and functioning better. If you need it shipped, we can ship it. If you're out of the state, you can't get out, or you're afraid to get out right now. Our office is open. We're kicking butt. People are coming in, and we're helping people as much as we can. So any questions, just shoot my way. Any comments, concerns, or if you have a question about the product, just let me know, and I'll be glad to help you. I look forward to seeing you and helping you any way I can. God bless. Have a great day. And don't break your ribs.